Now, as we've been talking about women problem on our obstetrics and gynecology channel, we've been touching some one or two common surgeries that are done for some of these procedures, not only for women. Okay, so most of those surgeries can be done for both sexes. Now, the next one which we are trying to have an introduction to is what is known as the exploratory laparotomy. We'll talk about the exploratory laparotomy. So exploratory laparotomy, understanding is quite simple. Okay, if you look at the word exploratory, okay, you see that the word explore is there. Okay, so exploratory. Okay, then laparotomy is like you're just opening up, okay, to explore. Do you understand? You are opening up to explore and find out any other issue that could be what wrong with the abdomen or coming down to the pelvis, okay, as in women. So it's just a major surgical procedure where the abdomen is open. Okay, so you have an issue in the abdomen. Yeah, it could be the pelvis too, because the pelvis is kind of like linked up with the abdomen. So you have an issue there, and you don't really, imaging is not really giving you, okay, or sometimes there's no imaging alternatives. It's not really giving you what you want. So you want to open up, go in, and actually check what is wrong. You know, so you want to actually open, you confirm the condition, and usually you also treat alongside. So it's also known as what celiotomy. It's a procedure. Involves making a large incision in the abdominal wall to directly, okay, see things for yourself. So you can both diagnose with it and both treat. So you say that it's diagnostic and therapeutic. Okay, so it's used when imaging tests have failed to actually reveal the main cause. Also, in some places, probably it's an emergency and imaging option will waste your time. Do you understand? So several reasons why you could actually do exploratory laparotomy. So purpose: if you have an abdominal issue and it's unexplained, you want to treat trauma-related injuries, you want to investigate a suspected cancer case, you want to identify issues and maybe obstructions and all of that. So procedure usually performed under general anesthesia. So a midline incision is done, okay, in the midline. Okay, so surgeons will now inspect organs like the liver, the intestines, the stomach, the pancreas, depending on what you're actually looking out for. So if a problem is found, you don't close up the patient, you treat. Okay, so that's what we have for what exploratory laparotomy is.